Hello everyone, my name is William Carroll. It's my very great pleasure to welcome you to the 2020 World Brain Day. This year's World Brain Day campaign is focused on Parkinson's disease. Next slide. This is the 7th year that we've held this event, and as with previous years, the World Federation of Neurology has partnered with an appropriate specific organisation from the Global Neurology Alliance. We are proud and honoured to have the International Parkinson and Movement Disorders Society join with us, and this evening especially to have its President Claudia Trenkwalder. World Brain Day continues to evolve from a single day in July 22nd, the anniversary of the foundation of the World Federation of Neurology. It now extends from that date for 2 to 3 months, which allows more flexibility and more exposure. The reach for World Brain Day has risen rapidly thanks to our media partners, Yakety Yak. Last year's World Brain Day campaign featured migraine, which was partnered with the International Headache Society and reached a total audience of more than 50 million people. This same webinar that you're looking at now that was held last year attracted some 2,000 registrants. World Brain Day is now also recognized by the World Health Organization and is listed as a World Health Organization named day. Next slide, please. Parkinson's disease is one of the neurological non-communicable disorders with stroke, headache, and dementia, and others, together represents the leading cause of disability and the second leading cause of mortality, according to the Global Burden of Disease Disorders study. The most recent global burden of disease showed a prevalence of Parkinson's disease to have risen from 2.6 million in 1990 to more than 7 million in 2016. You can see that on the left-hand slide. More importantly, and especially in this year of the COVID-19 pandemic, the prevalence of non-communicable disorders, including Parkinson's disease, is set to rise dramatically in coming years. Some data suggests an association with increasing industrialization and wealth. You can see that on your right-hand slide. The outlier here is up in the top right-hand corner, which is China, which is rapidly industrializing, and their age standardized rate of Parkinson's disease is increasing quite dramatically. Next slide, please. Today we have a series of 5 expert speakers from around the world, each of them addressing a topic crucially related to Parkinson's disease. Before we hear from them, there's no better way to set the scene for this important webinar than to listen to a person with Parkinson's disease. Today we have the opportunity to hear the story from one such person who is also a physician. I wish everyone an informative and helpful webinar, and I especially thank those attending and all of those who have helped prepare this 2020 World Brain Day. Thank you.
Hello, my name's David Blacker. I'm a neurologist in Perth, Western Australia. For more than 20 years I've done mainly hospital-based practice, with my subspecialty being stroke. I'm also a clinical professor at the University of Western Australia and the medical director of the Perrin Institute for Neurological and Translational Science, which is one of Australia's most exciting and innovative new neuroscience research institutes. I've been asked to say a few words about the upcoming World Brain Day with its focus on Parkinson's disease. Not because of any of the positions that I hold or the work that I do, but because I'm a Parkinson's patient myself. I've had it for quite some years now, and it initially began with an exercise-induced dystonia which affected my right foot. With the course of time, I developed more of the classical symptoms of bradykinesia, tremor, and difficulty writing. And just getting around and moving at work and filling in forms and paperwork became increasingly difficult several years ago. So whilst I knew it was there. It took me a little while to get the diagnosis confirmed independently by one of my colleagues. And about 18 months ago, I disclosed the diagnosis to my friends and colleagues. And that was quite an experience. But I'm glad I'm through that phase and into the next phase where I can start looking forward. Thankfully, I've had an excellent response to L-DOPA. But what and I'm sure many patients seek, is true disease modification and hopefully something to help with the non-motor symptoms. I'd really like to be able to smell properly again. I'd really like to have an uninterrupted, good, solid night's sleep every now and then. I sincerely hope that the emphasis of Parkinson's disease as the topic of World Brain Day later this month will help to stimulate ongoing research into treatments and more effective therapies for Parkinson's disease. I'm a firm believer that exercise, good solid physical exercise and lots of it, is an important core component of any Parkinson's treatment program. I think a healthy dose of probably non-specific aerobic exercise is important, but just as important, I think, is very targeted, focused, movement-based exercises that concentrate on balance, strength, and stability. I myself have been walking briskly for maybe 15 to 20 kilometres per week. I do 1 to 2 sessions of yoga per week, always including a long session of deep stretching. I play golf once or twice a week. But what I'm really excited about is non-contact boxing. This has been popularised mainly in North America, and there are many Parkinson's patients who are having a lot of fun doing it. But there's not a lot of good quality evidence about the correct dose, the optimal timing, and what to do at various different stages of PD. I'm in the privileged position of actually being able to answer some of those questions, and I'm in the process of developing a non-contact boxing program for Parkinson's patients. I've had the privilege of working with a former national boxing champion who's now a boxing trainer with more than 30 years of experience, in combination with a neurophysiotherapist, an exercise physiologist, and my movement disorder colleagues at the Perrin Institute. And I've been a guinea pig for this program, which we hope will start later this year. After only 4 or 5 months of very good training, I'm already feeling stronger. I think my balance is better and my endurance is better. So I remain optimistic about my own personal health, and I actually remain convinced that with very good, targeted, careful exercise, that we may have already a tool that helps to slow the progress of the disease. I therefore offer that encouragement to other people with Parkinson's disease, and I encourage you to be optimistic, to be healthy, to live your lives to the fullest extent that you possibly can. I also challenge my neurological and movement disorder colleagues to make the most of World Brain Day and to continue the search for better and longer lasting treatments for this condition. Thank you.
Thank you, David, for that wonderful, moving story. For many of us, David is a very well-known colleague for neurology and academic neurology in Australia and this part of the world. My name is Tissa Wijeratne. I am an academic neurologist from Melbourne, Australia. I am the chair for World Brain Day on behalf of World Federation Neurology as well as Movement Disorder Society, and I am a proud member of both these organizations. You already heard about the pandemic. You already heard about the fact that Parkinson's disease, number of Parkinson's disease patients are on the rise globally. Let me remind you, our proud partner for this activity, International Parkinson's and Movement Disorder Society, was born in 1985. Since 1985 to now, today is 22nd of July 2020, did you know that the number of Parkinson's disease patients in the world actually tripled? There is no other neurodegenerative disorder, including Alzheimer's disease, that is rising at that sort of an alarming rate. So it is important for us to reflect on number of people with Parkinson's disease is indeed over 7 million people across the world right now. If we continue to be complacent and inactive, this number is going to be massive, doubling and tripling in years to come. We are in this unprecedented COVID-19 pandemic. Although the original report reflected that there was probably no direct negative effect of COVID-19 on Parkinson's disease, some of the latest publications in movement disorders from Ray Chowdhury and colleagues remind us otherwise. It is early days, we have to watch the space. Bill already mentioned to you that brain disorders are leading cause of disability. I am inviting you to be disruptive and join our bandwagon of ending Parkinson's disease with the proviso or with the aim of ambitious agenda of ending this continuous carnage of uprise of Parkinson's disease, ending lack of care, and ending lack of research funding, and ending lack of support for caregivers, for which you would hear from my esteemed colleague in time to come. So I invite you all to embrace World Brain Day and keep on promoting advocacy efforts in Parkinson's disease in collaboration with your National Neurology Society, your National Movement Disorder Society, and your own World Federation Neurology and your own Movement Disorder Society throughout the next couple of months. And make sure that you mark your diary to join our colleagues and other folks from all over the world at the virtual booth at the virtual Movement Disorders Congress in September also. To make matters even more interesting, the entry is free, but make sure that you register for that as early as possible. Next slide, please. It is my great pleasure to invite the next speaker, who do not need a specific introduction. Professor Claudia Trenkwalder is the current president of International Parkinson's and Movement Disorders Society. Over to you, Claudia.
So thank you, Tissa. So I'm a neurologist and I'm professor of neurology at the University Medical Center in Göttingen. And I'm the current president, as you said, of the International Parkinson and Movement Disorder Society. Next slide, please. As you have already heard, Parkinson's disease continues to increase globally. And the older the people get, the more likely it is that they may develop Parkinson's disease. In the group of those aged 50 or younger, there is 1 in 100,000 people with PD. In the group over 60, 1 in 100. And finally, in the group over 75, it's already 1 in 50 people with Parkinson's disease. And these rising numbers globally depend on the increase of the elderly population worldwide, but also on the longer duration of the disease, as we have now better treatments. And as you have already heard, may depend on environmental factors. But not only the number of PD have increased, also the burden of disease, which means the amount of years living with disability, they have doubled for PD during the last generation. And these disabilities are caused by the various symptoms of Parkinson's disease. The next slide, please. So the key features of Parkinson's disease are the impaired motor skills, which include the slowing of movement, the bradykinesia, mostly starting in one hand or one leg, or just getting much slower at any daily activity or at walking. The typical tremor of Parkinson's disease is a tremor at rest, which occurs at times of relaxation, at watching TV, or just sitting. But any tremor will worsen with getting excited. A postural imbalance complicates the picture mostly after some years and may lead to falls. In addition to these impaired movements, there are many different we call non-motor symptoms in Parkinson's disease, which are early signs of the disease and are observed years before the diagnosis. A typical sleep disorder with lots of activities during the state of dreaming, loud screams, and even violations of patients or bed partners can occur. And this is called REM sleep behavior disorder, a very specific early sign of Parkinson's disease. Early features are also an impaired sense of smell, a dysregulation of the blood pressure while standing, so-called orthostatic hypotension, and even psychiatric symptoms can accompany early disease, but may also be present anytime during the disease. And this is mostly depression and or anxiety. The various combination of symptoms over time characterize the individual picture of the disease, which should be diagnosed as early as possible so that we can start with proper treatment. And with this, I'd like to bring this over to our next speaker. Thank you.
Slide, please. Our next speaker is Professor Wolfgang Grissold, the current Secretary General of the World Federation of Neurology. I should remind the audience that for us to get this job done, we all need to be good advocates. He has authored a brilliant book on advocacy that I would strongly recommend you all to read so that we can definitely end Parkinson's disease related suffering in time to come and rest of the other things that we mentioned. Professor Grissold, over to you to talk about advocacy.
Thank you, Tissa. My name is Wolfgang Grisold. I'm a neurologist from Vienna, Austria. And as Tissa said, I'm the Secretary General of the World Federation. I've been interested in neurology, and advocacy and palliative care and patient care is a big one. So I'm going to have the privilege to speak a little bit about advocacy. And literally, it means to speak for someone. And it is one of the essential duties of any physician or any healthcare professional. Advocacy activities are driven by an implicit altruistic motivation and are commonly associated with kindness, goodwill, and human strings attached, which are the essence of human communication. Advocacy can be done at several levels. It can be at the individual level for a person or for a cause, on a larger scale, like doing advocacy for an institution or a region, or on a larger scale, what we are doing now, on a global scale even, to promote a topic. Anyone can be an advocate independent of the professional grade. And also self-advocacy of lay people is sometimes very impressive and can teach us lessons. Advocacy for patients with movement disorders has a tradition within the World Federation and our partnering society, the MDS. A large number of patient groups and initiatives exist and can be found in the web. Parkinson patients of any age group need advocacy, not only for neurological care, for drugs, to receive treatment, rehabilitation, but also to stimulate research. The WFN emphasizes care for patients with Parkinson's disease in low-income countries, as well for persons with a migration background and for ethnic minorities. These groups face several barriers for advocacy, which are related to language and speech, to health literacy, culture, barriers of access, and in an often contaminated cultural environment. But even in countries with optimal medical care and complex social systems, Parkinson patients suffer from associated conditions and handicaps due to motor impairment and not Only motor symptoms, in particularly mental and psychiatric aspects, often result in isolation and loss of social contacts. The loss of social communication is not restricted to environment and carers, but can of course also affect the physician, patient communication, and the communication with other healthcare professionals, which causes a feeling of otherness and results in a loss of contacts and neighboring. Advocacy is also needed for the advanced stages of Parkinson's disease, where medications often have little or no effect. And patients who experience a decline in bodily and mental function need to receive adequate palliative care. Such activities also fall under the scope of advocacy. This webinar spans this wide range from patient experience to prevalence, disability therapy research, and advocacy and education in Parkinson's disease, and is meant to emphasize the need for advocacy at all levels of patients with Parkinson's disease. Thank you very much.
Our next speaker is Professor Victor Fung, who is by miles the most popular movement disorders teacher in Australia among trainees, which I know as a fact. Professor Fung would talk about recent advances and ongoing research in Parkinson's disease. Professor Fung, over to you.
So thanks, Tissa. So my name is Victor Fung. I'm a movement disorder neurologist in Sydney, Australia, and it's been my pleasure and privilege to serve the MDS in a number of educational and administrative roles. So my role is to speak with you about some recent advances in the treatment of Parkinson's disease. But first, I think it's useful to consider that it's been 50 years since the importance of dopamine deficiency in Parkinson's disease was recognized. And the long-term effectiveness and safety of levodopa as the cornerstone of treatment for Parkinson's disease has been clearly established. Many additional oral medications have also been discovered which assist in stabilizing the way dopamine replacement therapy is delivered to the brain. When oral therapy is no longer effective or insufficiently effective, major advances in device-assisted methods of delivering dopamine replacement to the brain or functional neurosurgery can help patients regain control of their disease and life. It's also been shown that not treating Parkinson's disease leads to progressive deterioration in function and reduced quality of life, as does inadequate explanation of Parkinson's disease to patients at the time of diagnosis. Therefore, before talking about recent advances, it's vital that clinicians and people with Parkinson's disease understand the diagnosis and best utilize the highly effective treatments that already exist. And as Professor Grissold has already mentioned, clinicians and governments also need to consider how to ensure that proven oral and device-assisted therapies are available to people of all countries and socioeconomic background around the world. Now, in the last 20 years, we've come to understand the importance of non-motor symptoms in Parkinson's disease, mood disturbance, cognitive and autonomic symptoms such as constipation, drooling, dizziness, sleep, fatigue, and lack of drive. These play a major role in affecting the quality of life of people with Parkinson's disease and their carers. Yet still, these non-motor symptoms remain relatively under-recognized and undertreated by clinicians. There's a relative lack of research into effective treatments of non-motor compared to research into motor symptoms, for which there are already highly effective therapies. Therefore, it's vital that new discoveries and knowledge already gained are better integrated into treatment and research. Most of the long-term problems of disease progression in Parkinson's disease relate to non-dopamine related and more widespread brain dysfunction. A much greater emphasis on addressing these issues is urgently needed. There is clearly hope on the horizon. Approaches to treatment which can potentially impact whole brain dysfunction, such as clearing alpha-synuclein or manipulating the gut microbiome, are examples of research already underway. Effective disease modification in Parkinson's disease will only be successful if a whole brain approach is taken and if we take it together. Thank you.
Next slide, please. It is my pleasure to invite our next speaker, Professor Susan Fox, who is the chair-elect Pan American section MDS. Susan is well known to the movement disorders world. Susan, over to you.
Thank you, Tissa. My name's Susan Fox. I'm a professor of neurology at the University of Toronto. I'm a movement disorder neurologist, and I've also served the MDS in many capacities, and I'm delighted to be here on behalf of the MDS. And I really want to thank the World Federation of Neurology for highlighting Parkinson's on this World Brain Day. So I'm going to talk about a very important topic, which is awareness and education. And we'd like to work together to diagnose earlier, treat more effectively, and improve the lives of both those living with Parkinson's disease and their caregivers. Parkinson's disease is a journey. It begins with a diagnosis, and it continues for the lifetime of a person with Parkinson's and their family, surrounding communities, and their healthcare professionals. There are many challenges and obstacles that each person will encounter that are unique to that person with Parkinson's disease. We're now increasingly recognizing the uniqueness of Parkinson's in individuals. One person with Parkinson's is not the same as another. And we know that the age, the gender, the genetics can all influence the way a person responds to medication or has symptoms with their Parkinson's. And this is leading us down the route of individualized medicine and precision medicine for everybody with Parkinson's disease. To help everyone with Parkinson's, we want to increase awareness. This awareness needs to be global, across the world, within every continent and country. And today's World Brain Day is just one large global effort that's going to bring, we hope, more awareness to the disease and the millions that are affected by it. And then thirdly, and most importantly, education is critical for people with Parkinson's and their caregivers to help them take this journey to understand the treatment and the management of this condition. But education also needs to extend to governments, to healthcare policymakers, to the general public, to support every person directly or indirectly affected by Parkinson's disease. Thank you.
Thank you, Susan. Next slide, please. I would now invite our President, Professor William Carroll, back to the podium to complete this webinar. As you can see, up to now, we have been building this theme of in a disruptive but charismatic way, how we could end various aspects of Parkinson's disease globally through solidarity and together. Bill, can you come back and then give us some concluding remarks for the global audience?
Thank you, Tissa. Thank you, colleagues, for your insightful and yet succinct comments on this topic. These are really, for those in the audience, what has been said, it's really just the key points at each of the topics. Parkinson's disease, as has been said, is a journey through life, and it affects every aspect of life. So we hope that this webinar will energize people to talk about Parkinson's disease, to advocate for better brain health in general, and we invite them to visit the website on the WFN website to see the toolkit which is available to help you spread the message that you've heard this evening. We hope that those who feel even more strongly about this will use the website toolkit to talk to their local press, to raise awareness within the media, to spread the message to people who don't understand Parkinson's disease, may not even know what it is, and certainly may not know what a burden it is. Overall, Parkinson's disease, as I said earlier, is one of the important non-communicable diseases which represents a brain disease. And this in itself is symbolic of the importance of our other message, and that is to raise the awareness of the importance of brain health through education, research access, and improve clinical service. And those things also apply to Parkinson's disease and Parkinson's disease caregivers. So I call on you to work together to promote better brain health globally, and in particular during this year's World Brain Day campaign to promote that for Parkinson's disease. Thank you. No, now it's unmuted.
Thank you so much to all who have attended. We will hand over the Q&A to Dr. William Carroll, and take it away, Dr. Carroll.
Thank you very much, Ashley. Thank you to the speakers and to the audience. We're ready to receive questions. I have none on my panel list at the moment, but maybe that'll turn up. Ashley, do we have any? Here we go. Okay, I have one here for you, Claudia. Can you hear me?
Yes, I can.
Okay, the question is it necessary that sleep disturbance, or is it possible that sleep disturbance can lead to Parkinson's disease?
That's a good question that has been studied already. And finally, we do not know the answer yet, but I would say it's vice versa. Parkinson's disease, even in the very early days, may lead to sleep disturbance. So if a year-long insomnia may lead to Parkinson's disease, I would say it's not likely. It's more likely that with the starting of the neurodegeneration in the brain, the insomnia, the sleepless nights may come up.
Thank you. I have a question for you, Victor. Dr. Fung, do many, and if so, how many, patients go undiagnosed in countries where there are not many resources for diagnosis?
So, as many of you will know, Parkinson's disease remains a clinical diagnosis in that there are typical symptoms, and when a person with Parkinson's disease is examined, very typical clinical features that can fairly accurately predict that someone has Parkinson's disease. So the diagnosis of Parkinson's disease is not too reliant on the availability of technical things such as imaging or MRI or CT, although those tests can be useful in ruling out something that might mimic Parkinson's disease. So the issue with diagnosing Parkinson's disease in underserved countries is more to do with the availability of doctors to actually see people and make the diagnosis. So where this has been studied, for example, in Africa, it seems as if the prevalence or incidence or how common Parkinson's disease is seems to be fairly similar no matter what ethnicity or what country someone comes from. So I think most of us believe that Parkinson's disease can affect anyone and everyone, and to a similar extent, no matter what your background is.
Thank you. Susan, I think this one might be for you. Where has it gone to? Beg your pardon. Can yoga help or cure neurodegenerative disease like PD, Alzheimer's or Huntington's?
Thank you for the question. Yes, it's very topical. It's a question that I often get asked by my patients in clinic about the exercise that they're doing. Will it help or even cure their disease? Unfortunately, at the moment, there's no proven therapy that can cure these devastating neurodegenerative diseases. But we do know that exercise of any form, as David Blacker very eloquently told you, can really help the symptoms. So, for example, yoga can improve the muscle tightness and stiffness that people with Parkinson's develop. But it's also good for the mood. It improves anxiety, it helps relaxation, it might help sleep. So I think it's a whole body exercise that I certainly encourage patients to do if they're able to do it. We know a lot about exercise that can help perhaps improve dopamine levels in the brain. And so really the bottom line with exercise is really any exercise that you enjoy doing and can do should be encouraged every day. Doesn't matter what you do as long as you do it on a daily basis.
Thank you. Thanks very much, Susan. I have a question for Wolfgang, I think. How can we help people to get diagnosed earlier?
Yes, thank you.
Could I just make one comment for everybody, all the panelists? Can you try and keep the answers succinct? We have many questions here, which is really good. Go.
Okay,
thanks, Wolfgang.
Thank you very much. And I think the answer is also very short: education. And it has been the task of the World Federation to promote education also in countries where there is no or little neurology. And this is the first point, to educate physicians, and also in many ways also healthcare professionals to be aware of the disease, to help and to promote the knowledge of Parkinson's disease. And I think with that, filling those gaps will help a lot. Thank you.
Thanks, Wolfgang. I think another one for you, Claudia. What is the difference between the REM sleep disorder of PD and diffuse Lewy body disease?
That's very easy to answer. There is no difference. REM sleep behavior disorder is the same, and you cannot differentiate if you just see the REM behavior disorder. Will this go into Parkinson's disease or into dementia with Lewy body? Indeed, even in the dementia with Lewy body, the percentage of RBD is almost 80 to 90%, whereas it's lower in PD. But you cannot differentiate.
Thank you. One for Victor and then one for Tissa. First to Victor. Oops, I've just lost it. It's coming. What are the most important open research questions?
So the biggest open research question, which we don't have any answer to at the moment, of course, is what is an effective disease modifying therapy? You know, what is a treatment that can slow the progression down? Obviously, the ideal would be to halt it altogether or to reverse it. There's one medication for which there's some weak evidence that it might slow the progression of Parkinson's disease a little, but that's all we have at the moment. So that one of the biggest hindrances, I think, to actually answering that question is we actually don't have a good way of measuring disease severity and progression. So, and that's really something that hasn't been attended to adequately at all. You know, there's very little research that aims at understanding how we can actually measure the disease. So if you can't measure the disease, how can you measure whether something's slowing it down or not? And then I think the other major gaps in knowledge are, you know, we've heard that non-motor aspects of Parkinson's disease have a major, and in some people, the dominant impact on quality of life. And yet there's very few good studies that, for example, tell us what is the best way to treat anxiety or depression that can have a more significant impact on quality of life than motor symptoms. And then things like constipation and drooling, which also impact greatly in terms of people's lives, you know, are hardly studied at all. So lots of gaps, unfortunately.
Thanks, Victor. It may come up again in later questions. Tissa, what are the different subtypes of Parkinson's disease, and is there value in separating them? You might be muted.
That's a great question. Basically, the Parkinson's disease itself is a single disorder. However, there are subtypes of Parkinson's disease, basically very young onset Parkinson's disease due to genetic involvement. Then there are Parkinson's disease that occur with tremor dominant, tremor non-dominant. Then there are very mild version of Parkinson's disease, which are also known as SWEDs, or in other words, some Parkinson's symptoms, but no neuroimaging features suggestive of significant dopamine deficiency. The other way to classify Parkinson's disease is idiopathic Parkinson's disease and Parkinson's plus syndromes. In other words, cousins of Parkinson's disease. So in a way, it is important for us to differentiate these things to answer some of the questions that some of the other audience was asking. I hope I have answered the question. Victor, is there anything else that you want to add?
No. Susan, there's a question for you here. When there's so much information on Parkinson's disease online, how do you suggest people with Parkinson's disease and their caregivers should look for the information that they need?
Yes, this is a very good question. There is certainly a lot of information out there online, and a lot of it is very helpful, but you do have to check what the source is. I would agree. There are many patient foundations that provide excellent resources. Depending on where you are in the world, there are many in North America, in Europe, Parkinson Foundation, Parkinson societies, and I would certainly suggest that you go to those websites to start with. The International Parkinson and Movement Disorder Society has some patient information leaflets as well on the website that you can certainly download, and they're in many different languages. Also asking your own doctor, your own nurse that you visit in the clinic or the hospital could also direct you to local resources that would be reliable and trustworthy. But there is a lot of information there for yourself with Parkinson's and your caregivers, and hopefully it is helpful.
So I have another question here which I might tackle. How available are anti-Parkinson's disease drugs globally? This is a big issue in the world today, not just to Parkinson's disease, but all medications, the inequality of access to both medications and quality care. And the World Federation of Neurology has as one of its main aims to address this. We work with our member societies around the world. We work with the World Health Organization, which has this as one of their key goals. And we're also conducting our own registry of needs in the different countries around the world, so looking at accessibility to a number of important but regularly available drugs, or should be regularly available drugs, and their ability to be distributed. And that's an important barrier, as well as cost, is actually the distribution pathway in a region or within a country. So they are largely available around the world, but some of the more refined ones will not be, because there is a cost associated with them still. The high cost of medication is another huge barrier, and that is something which has to be tackled, I think, at multi-national level, at UN level, and not just a list of what should be available, but a means to make them available has to be developed. So it's a very good question and a very intractable problem. Next question, unless someone wants to add to that. Wolfgang, Tissa?
I think one thing to mention is, Bill, the trying to match education and lack of availability. When I was interviewing some of the countries in sub-Saharan Africa, I came to know that there was very little availability of some of the basic drugs. But the same neurologist told us that by educating and raising awareness, still they can support these patients by exercise, rest of the other things to improve their quality of life. So I just wanted to add, despite the limitations, it is still important to raise awareness and advocate for other issues that you currently mentioned.
Yes, there's no, you're absolutely right. Advocacy and trying to leverage governments to make these available is one effective and more immediate mechanism, but it still takes time, and time is something which people with these conditions don't have that much of. Claudia, would you like to comment on what MDS is doing on this accessibility issue? Have you got any programs up and going or thoughts on developing them?
So currently we do not have specific programs, but we get alerted from our different sections sometimes about a specific need. And as we have good contacts to the pharmaceutical industry, then at least last year, as there was even a lack of levodopa in some regions, we have contacted the pharmaceutical industry and have written letters, and there were phone calls to improve that situation for these regions. But as you say, I think we need a global, also a political approach here with the health systems to improve the situation.
Thanks. Yes, I agree entirely. And it's not going to be done by one organization or one country. It's going to take a combined effort of a number of actors, so to speak. I have a couple of questions here which have already been touched on, but won't hurt emphasizing. Victor, what is, in your opinion, the main challenge to the treatment of Parkinson's disease? I think you've touched on this, but it might be worthwhile expanding.
Mm-hmm. So, well, I think sort of at a global level, I would really like to sort of reiterate, what we've just discussed. The main challenge is not delivering expert care to a small group of people with Parkinson's, but it's actually delivering care to so many people around the world with Parkinson's disease that don't even have, a basic level of care. So, but from a research and capability point of view, really, I think we actually, in many ways, we've actually not solved, but we have highly effective treatments for motor symptoms of Parkinson's disease, really, and dopamine sort of responsive symptoms till very late in the illness. And so, and yet there's still a lot of emphasis on treating motor symptoms with more complex solutions, whilst neglecting non-motor symptoms, which could be, potentially treated with fairly simple solutions. But there's a relative lack of research into those areas. So I think that a focus on non-motor symptoms of Parkinson's disease that are, in a situation where motor treatment is available, it's really non-motor symptoms that give the greatest burden of impairment of quality of life.
Thank you. A question here: how often is it recommended that Parkinson's disease patients have a follow-up appointment, and how do we optimize peer support during this present COVID pandemic? I think that could go to Tissa or to Susan. Tissa, would you like to comment?
That's a good question. I think in my own practice, there is no sort of a set rule for everybody. It's individualized. Some patients you might end up seeing them fairly frequently, up to once every 2 to 3 months. Some very stable patients, you might end up seeing them once every 8 to 9 months, sometimes even annually. To the other question, what can we do during COVID-19 pandemic? I think it is very important that the patients and the treating teams keep in touch electronically, telemedicine-wise, face-to-face where possible, so on and so forth. So to summarize, it's individualized depending on the patient needs. It is predominantly patient focused, and depending on the needs, you might see them more frequently or infrequently. Despite the COVID-19 pandemic, most of us, we still keep in touch with our patients in an electronic mean and telemedicine-wise, which is still the case even in Melbourne, where I live, while there is a very active COVID-19 pandemic happening at this point of time. Susan, you wanted to add anything to what I mentioned?
I would agree, Tissa. I think that the ability of virtual care to continue and to enable us to keep in touch with patients has been invalid during COVID, using either telephone or video technology. The only other important point I would make is that if you have Parkinson's and you have medical problems, you really need to see your doctor or go to the hospital. Even with COVID, we are seeing people who are delaying treatments and staying at home because they're afraid of going to the hospital, and we really don't want people to be suffering unnecessarily. So medical establishments are safe places to go. They have PPE, they have infection control in place. What we really don't want people to be doing is delaying unnecessarily the care that they need if necessary.
Thanks very much, Susan. I have another question for you that's been specifically directed to you. Are there innovations in development to use a multidisciplinary approach to treating patients with Parkinson's disease?
Yes, this is an excellent point, and the concept of multidisciplinary care to look after people with Parkinson's has been around for many, many years. So this would include not just exercise and approaches, for example, with either formal exercise with a physiotherapy or informal exercise, but the input from a social worker, occupational therapist, as well as other specialities that we often involve in the care of a patient with Parkinson's, for example, neuropsychiatry. So absolutely, this is the ideal model for looking after somebody with Parkinson. It will, however, depend on the healthcare system in your country, in your region, and obviously the ideal may not necessarily always be the case, but yes, this is something that has been looked at in many, many parts of the world, and would be really the ideal way of looking after somebody with Parkinson.
Thanks, Susan. Claudia, you touched on this in your presentation. You might like to expand on it. What is, in your view, the cause of the dramatic increase in the numbers of people with Parkinson's disease?
I think the major cause is fortunately that people are getting older. So an increase of the lifespan, especially in Europe and in the US and in the Western countries. But as we saw from the numbers that you showed, Will, also in China. And there we will have really a dramatic increase of the numbers, but also that the treatment of Parkinson's disease has improved. When I started in my hospital 15 years ago, we saw patients which came with 5 to 8 years Parkinson's. Now we see patients with 20 years of PD. So the duration of the disease is longer due to better treatments. But then, in addition, we may also have these environmental factors that we cannot really know or estimate exactly about, more toxins, other environmental problems that let increase numbers of PD.
Thank you. I think there are a couple more questions before we close. Wolfgang, you might like to answer this again and expand on it a little if you can. How do you think we can improve awareness of better diagnosis of Parkinson's disease?
Yes, thank you, Bill. I think, as I said before, one of the key points is that we improve in education and we support those countries that are really in need for care. The World Federation has done several programs, and I think our most prominent one is the department visits, where we not only try to bring people to the department, but exchange ideas, which are very fruitful. And also the teaching centers, where we try to empower the local societies and the local countries, in particular African countries, to teach neurology on their own. So this is the top level. And of course, I'm aware that the top level is just the top level. And what we have to do and what we have to learn is to improve advocacy, let's say, healthcare professionals, not only the nurses, which play an important role, but also physiotherapists who have a very strong position, social workers, and of course, also among carers. So my opinion is, and this is a definite role for the World Federation, who, as Bill said before, politically tries to tackle it from the side of needs and from awareness, from the medical side, from the neurological side. And it's not only neurologists, but the whole complex of multidisciplinary neurologic care. Thank you.
Thanks, Wolfgang. Last question, Claudia, for you specifically, it's requested. Is there evidence of children getting Parkinson's disease? If so, what are the major signs and symptoms?
So this is very rare. So usually to find a child with Parkinson's disease, these are part of the genetic forms, and maybe Victor can add then also something to this. But these children, I would say they have, if they have PD or Parkinson's syndrome, they classically start with dystonia, not with the akinesia or tremor, but with the foot dystonia, for example. And this may then bring up PD, but it is a very rare disease, a more a genetic form. And maybe Victor, you have just founded in the Movement Disorder Society, the Pediatric Special Interest Group. You may add to that.
Yes, no, I would agree with what you say, that it's much rarer than in adults, and where it does occur, often it's mixed with dystonia as a symptom, and it's almost always genetic. Particularly in very young children, in infants and young children, there's a significant chance that those people can actually, rather than having a degenerative process, actually have a metabolic block in the ability of the brain to produce dopamine, and those people can respond and essentially be cured by dopamine replacement, because those children don't have a neurodegenerative disease. So one of the dictums we have is that every child with, certainly with Parkinson's symptoms, but with even dystonia, should be given a trial of dopamine replacement therapy.
Very important point. Thanks, Victor. Any of the panelists have any final comments on the questions which we've fielded or hope to think we've fielded before we close this?
So maybe I'd like to add one point.
Yes.
So the COVID-19, actually, if people are looking for advice how to care about Parkinson patients, they can go also to the Movement Disorder Society website, and we have produced some articles, and there is some advice from our telemedicine task force that may help to continue with the right care for PD during the COVID-19 pandemic.
Thanks very much. We will have that. We have that website on this webinar after we finish this webinar now, but will be available for the attendees. Would that your website be on that? If not, we can include it. Claudia?
Yeah.
Okay.
I think we will still be there, and you can also put questions there and we can answer them.
Exactly. Yes. Is this our final slide, Ashley?
This is Bill.
Thank you very much. So on behalf of the World Brain Day team and Yakety Yak, I'd like to thank all the participants who came and viewed and listened to this webinar. Particularly, I'd like to thank the panelists for their presentations, and I wish you all the very best in caring for those patients that you have and those relatives that you have and those people that have this condition. It is still a very difficult condition, but with early diagnosis and the appropriate specialist advice on which treatments to use, patients have a much better life. We've heard, as we've heard from the speakers, that the main goal, if you like, that we are seeking is a disease-modifying drug that will slow the progression of this condition and lead to a cure. We won't get that without raising awareness, and with awareness comes education, and with both of those comes research, and with research come results. So it's a clear line of action that we have to take. All it takes is marshalling our forces, getting enough support, and getting the research done. In the meantime, those patients who need the care need to have the best care that there is available. So I hope that you've enjoyed the webinar. I hope that you helped spread this message to friends and others, and that you enjoy reviewing this webinar when you receive it. There will be a possibility of asking further questions remotely after we close, and we will endeavour to reply, but they will be a written reply as part of the webinar. Thank you very much.
Okay. Morgan, are we offline now?